Asymmetrical eyelid. How much would it cost and can it be fixed permanently? My left eyelid is a normal one, and my right eyelid is the uncomfortable and asymmetric lid. If I squint and pinch or something, I can get the right eyelid to look like my left eyelid for like a blink. Is there any way to make my right eyelid to be what it used to be? Any recommended doctors in New York?
Thank you for your question. You've submitted two photos, and you state in your question that your left eye is the normal eye, and that your right eye periodically has this partial crease that forms, and you're asking, is there a way to more permanently maintain a certain look, and that you squint your eye to try to force the eyelid fold to hang over. So it's a very good question, and certainly what is important to at least understand before you think about a treatment is what the basis or the anatomy of this area is all about. Just to give you a little bit about my background, I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I specialize in cosmetic surgery of the eyes and face, and I have a particular specialty focus on Asian eyelid surgery. Now, for a question like this to someone like me, very often the desire for the patient is to have both eyes to have a crease. And so to understand why there's this asymmetry in your situation, let's just look at the anatomy of the eye. What creates the eyelid crease? Well, about 50% of people of Asian origin have an eyelid crease and 50% do not. And one of the most popular surgeries that is desired is Asian eyelid crease surgery. And of course, there are many different ways to do this for different situations. In your situation, it appears that the fibers or the connections between a muscle called the levator muscle are attached to the skin in a way that periodically in the right dynamics will pull the skin inward and create this partial crease, while on the other side there aren't any good strong attachments, and therefore you don't have a more constant fold. Now, from my experience, I generally discourage anybody to do surgery to try to detach the eyelid crease in order to get more of a fold. The reason is that anytime you do any kind of surgery in the space around the eye called the orbit, you're at risk of losing some tissue and then getting even a potentially deeper crease. And not an intended crease like we do when we try to create a specific type of height and shape as we do in non-incisional or incisional Asian eyelid surgery, but rather the type of folding that might not look so good when the surgery is done. In situations like this, it might be worth trying a filler, such as in the hyaluronic acid family, such as Restylane, to try to create some volume in the space that would create this fold. Now, of course, understanding that these fillers are not permanent, therefore they need to be maintained, and that anytime you use a filler, which means you have to enter the skin with the needle, you could end up with a bruise or some swelling. Now, some people also, and I used to do this many years ago before the fillers came around, we used to place fat grafting. Now, I did that mostly for patients who had previous Asian eyelid surgery and they had too much of a hollowing, or the volume was loss was created that was almost like a letter A in the shape of how their eyelid crease went up. So I would not recommend that in your situation. I think the surgery would be unnecessarily traumatic, and I think that the risk and benefit doesn't make sense. Now, in some patients, just like what you described, If the eyelid position or the eyebrow position is what is responsible for creating the crease. In other words, if the brow is low and the fold stays more constant, well, then you might want to consider just doing some Botox in the forehead. Again, you're young and it's unusual or atypical to have Botox because usually that's for fine lines and wrinkles. But in trying to figure out a way that makes you more comfortable, if this is a source of discomfort for you to the point where you've reached out and asked a question, then these less invasive experiments, if you will, can be a way to figure out whether or not it's worthwhile for you to do this in a semi-consistent way for maintenance. So in summary, there is no perfect solution for this. There are options such as Botox and fillers that can try to make this, create this appearance more consistently without your effort. So learn about these options, meet with doctors who have experience with Asian eyelid surgery, and take it from there. So I hope that was helpful. I wish you the best of luck, and thank you for your question.